In the stillness of the night, while the body drifts into what should be peaceful rest, something unexpected happens. The rhythm of breathing is interrupted. The chest rises, but no air flows. A silent struggle begins. This is the hidden world of sleep apnea. Sleep apnea is a disorder where breathing repeatedly stops and starts during sleep. These pauses can last for seconds, sometimes even longer, disrupting the natural cycles of rest and preventing the body from reaching deep, restorative sleep. To understand why this happens, we need to look deeper into the airway. Normally, the muscles of the throat stay slightly tense during sleep, keeping the airway open, but in sleep apnea, that balance is lost. The airway collapses or becomes blocked, restricting airflow. This drop in oxygen sends alarms through the body. The brain briefly awakens the sleeper, often without awareness, just enough to reopen the airway. But this cycle repeats again and again, fragmenting sleep and straining the cardiovascular system. There are three main types. Obstructive sleep apnea, OSA, the most common form caused by physical blockage of the airway, often when throat muscles relax excessively. Central sleep apnea, CSA. Here, the problem lies in the brain. The brain fails to send the proper signals to breathing muscles. Mixed sleep apnea, a combination of both obstruction and faulty brain signaling. But who is most at risk? Obesity increases fat deposits around the upper airway, narrowing the passage. Aging causes reduced muscle tone in the throat. Anatomical features like a thick neck, enlarged tonsils, or a receding jaw make airway collapse more likely. Family history suggests a genetic component. Smoking and alcohol relax airway muscles, worsening obstruction. Medical conditions such as heart failure, stroke, and hormonal disorders like hypothyroidism can increase the risk. Men are affected more often than women, though risk in women rises after menopause. Children are not spared either, especially those with enlarged tonsils or adenoids. The symptoms stretch far beyond just snoring. In adults, loud and chronic snoring is often accompanied by episodes of choking or gasping during sleep, morning headaches, difficulty concentrating, mood changes, and persistent daytime fatigue. In children, the signs can appear differently. Restless sleep, bedwetting, behavioral issues, poor school performance, and slowed growth due to disrupted hormone regulation during sleep. Left untreated, sleep apnea silently damages the body. Repeated oxygen drops put strain on the heart, increasing the risk of hypertension, arrhythmias, stroke, and heart failure. The constant fatigue heightens the risk of accidents and impairs memory, learning, and decision-making. In children, untreated sleep apnea can affect growth, behavior, and brain development. Diagnosis often begins with suspicion, reported snoring, pauses in breathing, or overwhelming sleepiness. But the gold standard is a sleep study known as polysomnography. This test records brain waves, oxygen levels, heart rhythm, and breathing patterns overnight, painting a clear picture of what happens during sleep. The good news is, sleep apnea can be managed. Lifestyle changes like weight reduction, avoiding alcohol, and quitting smoking reduce the burden on the airway. Continuous positive airway pressure, CPAP, delivers steady airflow through a mask, keeping the airway open. Oral appliances reposition the jaw and tongue to maintain airflow. In children, removal of enlarged tonsils or adenoids can be curative. For severe or structural causes, surgery may be considered. And in central sleep apnea, addressing the underlying neurological or cardiac condition becomes essential. Sleep apnea is more than snoring. It's a disorder that affects the body, the mind, and even survival. Recognizing its signs and seeking proper care can restore restful nights, protect the heart, and safeguard life itself.